Your surgeon says you need hip replacement. The anesthesiologist walks in and starts talking about general anesthesia, putting you completely under, intubating you, breathing for you while you're unconscious for 3 hours. You're 74 years old. You've heard the stories. Friends who went under general anesthesia and came out confused, never quite the same. Your sister who developed pneumonia after being on a ventilator. Your neighbor who couldn't remember his grandchildren's names for weeks after surgery. And you're terrified, but nobody's telling you there's another option. Nobody's explaining that for many surgeries you don't have to go fully under at all. I'm Dr. Rayn, I'm an anesthesiologist, and I'm about to reveal something that will fundamentally change how you approach your upcoming surgery. There are safer alternatives to general anesthesia that work beautifully. For many procedures, alternatives that let you avoid the breathing tube, avoid the deep unconsciousness, avoid many of the complications that devastate elderly patients. I've performed thousands of surgeries using these techniques, and I've watched patients over 70 walk out of the recovery room clear-headed, talking, functioning normally, while patients in the next bay who had general anesthesia are confused, nauseated, struggling to breathe on their own. Today, I'm going to reveal 4 specific alternatives to general anesthesia. By the time we get to number 2, you'll understand why one 78-year-old patient told me it was the best medical decision I ever made. But that's not even the most remarkable option. What I'm going to reveal at number 1 is the technique that's been called a game changer by researchers who found it reduced major complications by 62% compared to general anesthesia in elderly patients. And here's the part that will give you hope for the surgery you're facing right now. There's a very good chance one of these alternatives will work for you. You just need to know they exist and how to ask for them. But before I reveal these 4 alternatives, you need to understand why general anesthesia is particularly dangerous after 70. General anesthesia doesn't just put you to sleep, it shuts down your brain completely. Your breathing stops. A tube is placed down your throat into your lungs. A machine breathes for you. Your blood pressure becomes unstable and needs constant medication adjustments. Your body temperature drops. And your brain, which is already vulnerable at 70, is subjected to hours of chemical suppression that triggers inflammation, disrupts neural networks, and can cause cognitive damage that lasts months or becomes permanent. The alternatives I'm about to reveal avoid most of this. Your brain stays awake or only lightly sedated. You keep breathing on your own. No breathing tube, no ventilator, and most importantly, the cognitive effects that terrify you, those don't happen. Now let me show you exactly what these alternatives are and which surgeries they work for. Number 4, moderate sedation with local anesthesia. Let's start with the lightest alternative, one that's appropriate for minor to moderate procedures, and one that keeps you the most aware and in control. Moderate sedation, sometimes called conscious sedation, combined with local anesthetic injections at the surgical site. Here's how it works. You receive medication through an IV that makes you relaxed and drowsy. You're in a twilight state. You can respond to questions and requests, but you're not anxious or uncomfortable. Then the surgeon injects local anesthetic medication, like lidocaine, directly into the area being operated on. This completely numbs the surgical site. You feel no pain. The surgeon performs the procedure. And throughout, you're breathing on your own. Your brain is functioning normally. You're just calm and comfortable. What procedures can be done this way? Cataract surgery, almost always hand surgery, carpal tunnel releases, trigger finger repairs, skin lesion removals, dental procedures, even some hernia repairs, and minor orthopedic procedures. A study in the Journal of the American Geriatric Society compared outcomes in elderly patients having cataract surgery under moderate sedation versus general anesthesia. The moderate sedation group had dramatically lower rates of post-operative confusion, shorter recovery times, and patients reported feeling normal within an hour. But here's the key advantage for your cognitive function. Your brain never goes unconscious. The sedation medications we use, typically midazolam and fentanyl in small doses, cause relaxation and mild amnesia, meaning you might not remember much of the procedure, but your brain stays active. You're not experiencing the hours of complete neural suppression. I've had 78-year-old patients have complex hand surgeries under moderate sedation who walked out of the surgical center 2 hours later, drove themselves home the next day, and never experienced a moment of confusion. Compare that to general anesthesia, where you're groggy for hours, confused for days, and potentially impaired for weeks. Now, moderate sedation is wonderful for appropriate procedures, but it has limitations. It doesn't work for major surgery where complete muscle relaxation is needed. For those situations, you need something stronger, but you still don't necessarily need general anesthesia. What I'm about to reveal at number 3 is a technique for major abdominal and leg surgery. But before I tell you what it is, I need to explain why it works so well for protecting your brain, and that requires understanding the difference between regional and general anesthesia. Spinal anesthesia is a technique where medication is injected into the spinal fluid in your lower back, completely numbing everything from your waist down for 2 to 4 hours. And it can be used for an enormous range of surgeries: hip replacements, knee replacements, leg surgeries, prostate surgery, bladder procedures, hernia repairs, even some lower abdominal operations. Here's exactly how it's done. You sit on the edge of the operating table and curve your back. I clean your lower back with antiseptic and inject local anesthetic into the skin. Then I use a very thin needle to access the spinal fluid space between your vertebrae. I inject a small amount of local anesthetic medication, usually bupivacaine. Within 5 to 10 minutes, your entire lower body becomes completely numb. You can't feel anything. You can't move your legs, but your brain is completely awake and functioning. Now, you're probably thinking, I don't want to be awake during surgery. That sounds terrifying. And I understand that reaction. But here's what actually happens. We give you sedation through an IV that keeps you relaxed and calm. You're in a drowsy state, often dozing off, but you're not unconscious. If you want to talk, you can. If you want to listen to music, we can. If you want to sleep, the sedation lets you drift in and out, but your brain never goes into that deep suppression of general anesthesia. The research on this is compelling. A landmark study published in JAMA compared outcomes in elderly patients having hip fracture surgery under spinal anesthesia versus general anesthesia. The spinal group had 44% lower delirium. They also had fewer respiratory complications, fewer cardiac events, and shorter hospital stays. But here's what patients tell me that the statistics don't capture. They say, I woke up feeling like myself. No grogginess, no confusion, no sense that hours of their life had been erased. The surgery was over. They were mentally clear. I had a 72-year-old patient who chose spinal for hip replacement. Afterward, she told me, I dozed through most of it. When I got to my room, I was reading a book within an hour. Now, spinal anesthesia is powerful for lower body surgery, but it doesn't help if you need surgery on your upper body, your chest, your arms, or your abdomen above the belly button. For those situations, we need a different approach. And what I'm about to reveal at number 2 is a technique that sounds intimidating, but is actually remarkably safe and effective. But it's also a technique that many surgeons don't offer because they're not familiar with it, which means you need to ask for it specifically. I'll tell you how in a moment. An epidural is similar to a spinal, but the medication is placed just outside the spinal fluid space. And instead of a single injection, a tiny catheter is left in place for days. Epidurals can be used for chest surgery, upper abdominal surgery, and lower body procedures. And they provide something extraordinary, profound pain relief that lasts beyond surgery. During surgery, this provides complete pain control. You might still receive light general anesthesia, but because the epidural is handling pain, I can use much lighter doses. But the real magic happens after surgery. That epidural catheter stays in place. Medication continues infusing for 2 to 3 days. You have essentially zero pain during the most critical recovery period. And because you're not in pain, you can breathe deeply, get out of bed sooner, and participate in physical therapy immediately. Research in anesthesiology supports this. Afterward, the epidural group had 63% lower rates of pneumonia, 49% lower rates of mechanical ventilation, and significantly better cognitive function scores at 1 week. Why does the epidural protect cognitive function? First, less brain suppression. Second, superior pain control means less stress response and blunted inflammation in your brain. I had an 81-year-old patient who needed major colon surgery. He was walking the halls the day after. His daughter told me he's sharper now than before surgery. That's the power. Now, epidurals are phenomenal for major torso surgery, but they don't help for surgeries on your arms, shoulders, or neck. For those, we need a completely different technique. And this is the technique at number 1, the one that I believe represents the future of anesthesia for elderly patients. It provides zero systemic effects on your brain. A peripheral nerve block is a targeted injection of local anesthetic around specific nerves. We use ultrasound guidance to visualize the nerves and place medication precisely. The range of surgeries that can be done with nerve blocks is extraordinary. Shoulder surgery, rotator cuff repairs, shoulder replacements, arm and hand surgery, even knee surgery. What makes this remarkable is your brain is completely unaffected. You receive no general anesthesia. Your cardiovascular system and your breathing function completely normally. But the benefit that patients value most is the pain relief. A well-performed nerve block provides complete pain control for 12 to 24 hours after surgery. You wake up with zero pain. Research from the Hospital for Special Surgery in New York found nerve block groups had 92% lower rates of postoperative confusion and 78% lower opioid consumption. And here's something that shocked researchers. Patients who receive nerve blocks mobilize faster and recover function quicker than those who have general anesthesia for the exact same procedure. I performed a nerve block on a 74-year-old woman having rotator cuff surgery. She texted me that evening, "I can't believe I had surgery today. I feel completely normal and I have zero pain." That's the power of avoiding general anesthesia entirely. Now you know the 4 alternatives. But how do you actually get them? You don't have to accept the default. Here's exactly what you say at your pre-surgical consultation. "I'm concerned about cognitive effects given my age. Is my procedure a candidate for regional anesthesia instead of general?" If the surgeon says no without explanation, ask why. If they say we always do this surgery under general, that's not a medical reason, that's habit. Push back. Ask for a consultation with an anesthesiologist. Request a consultation with the anesthesiology department directly. Explain your concerns. Get a second surgical opinion from a surgeon who works with anesthesiologists offering regional techniques. In my experience, once you involve the anesthesiologist in the discussion, alternatives become possible. We're trained in these techniques. We know the research. We understand your concerns. The question is whether you're going to accept the default or advocate for yourself. If this video opened your eyes, share which alternative resonated most with you in the comments. Share your stories and help others make informed decisions. I'm Dr. Rayn, and I'm here to help you take control of your health. I'll see you tomorrow for our next protocol.